Good day to everyone. My name is Jerome Marshall A. Cortez, a student from the Medical College of the Northern Philippines, and I'm going to perform the newborn suctioning. First is gather all the materials needed. Check each medication order against the regional physician's orders according to the agency protocol. Check the patient chart for allergies. To know the action, especially the nursing consideration, safe dose range, purpose of administration and adverse effects of the medication to be administered. Consider the appropriateness of the medication of this patient and perform hand hygiene. Adjust the bassinet to comfortable working position. If patient is unconscious, him or her in semi-Fowler's position. If patient is unconscious, place him or her in the lateral position, facing you. Move the bassinet close to your work area in raises to the waist high. Place a towel or waterproof pass across patient chest. For adjust suction to appropriate pressure, for our unit 60 to 80 mmHg. Put on disposable clean gloves and occlude the end of connecting tubing to the check suction pressure. Place the connecting tubing in convenient location. Open sterile suction package using the aseptic technique. The open wrapper or containers become a sterile field or hold the supplies, carefully remove the sterile container. Touching only the outside surface. Set it up at work surface and pour a sterile sealing into it. Place a small water-soluble lubricant or the sterile field, taking care to avoid touching the sterile field with the lubricant package. Increase the patient's supplemental oxygen per facility policy or physician order. Put on a face shield or goggles mask. Put on sterile gloves. The dominant hand will manipulate the catheter and must remain sterile. The non-dominant hand is considered clean rather than sterile, and we will control the suction. With the dominant hand, pick up the sterile catheter, pick up to connecting tubing by the non-dominant hand, and connect the tubing and suction catheter. Moisten the catheter by dripping into the container sterile saline. Include white tube to connect suction. Apply lubricant to the first 2 to 3 of the catheter, using the lubricant that was placed of the sterile field. Remove the oxygen delivery device if appropriate. Do not apply suction as the catheter is inserted. Hold the catheter between your thumb and the fingers. For nasopharyngeal suctioning, gently insert the catheter through the nares and along the floor of the nostril toward trachea. Roll the catheter between your fingers to help advance it. Advance the catheter appropriately to reach the. And for the oropharyngeal suctioning, insert the catheter through the mouth along the advice of the mouth toward trachea. Advance the catheter reach of the praxia. Apply suction by the intermittently, occluding the Y port of the catheter with the thumb of your non-dominant hand, and gently rotate the catheter as is being withdrawn. Do not suction more than 10 to 15 seconds at a time. Place the oxygen delivery device using the non-dominant hand. Flush catheter with saline. Assess effectiveness or suctioning and repeat as needed according to the patient tolerance. Wrap the suction catheter around your dominant hand between attempts, and allow at least a 30 seconds to 1 minute interval if additional suctioning is needed. No more than 3 suction passes should be made per suctioning episode. Alternate the nares unless contraindicate. If repeated suctioning is required. Do not force the catheter through the nares. Suction the oropharynx after the suctioning of the nasopharynx. When suctioning is completed, remove gloves from dominant hand over the coiled catheter. Pulling in off inside out, remove gloves from the non-dominant hand and dispose of gloves. catheter, and container with solution of appropriate receptacle. Remove face shield and goggles and face mask. Perform hand hygiene. Turn off suction. Remove supplemental oxygen placed for the suctioning. If appropriate, assist patient for the comfortable position. Do not oral hygiene to the patient after suctioning. Reassess patient respiratory status including respiratory rate, effort, oxygen saturation, and lung sound. Document procedure to the patient chart.